We're live. It's a new day, a new Sunday. And Tony, boy, before I forget, do you realize that it is actually 1 year next week since we started this show?
Well, you gotta celebrate.
Yeah.
What are you celebrating? You celebrating 1 year of hardship,
Hard knocks.
hard knocks, and run the people and drive the people, and people come back and then we run them again. Boy, let me tell you something. All I can say, let's say it like this way. Thank God I still here.
Thank God you're still here.
You're still here. You're still in the chair. I can thank God for that, because sometimes you don't even feel good. You feel like pack it up and go. But stressful week. But I'm here.
Yeah.
I've been kicking. And so, how you doing other than that, Melanie?
Me, I had a terrific week.
You did?
Very quiet, doing anything that I like to do.
Yeah.
Mm-hmm.
Oh, well.
Quiet, and I've been watching what's been happening with healthcare systems around the world and this new variant of COVID. And I kind of anticipated that this was going to happen. And, you know, when the government was doing what it had to do in terms of locking the country down to reduce the number of cases.
You mean the government's doing nothing, you mean?
Well, yes and no.
That's what you want to say?
Yes and
The
no.
government just shut the country down. That ain't nothing.
But when it was shut down, they should have been doing some preparatory.
Exactly.
Right?
I agree.
And right now, the whole system is just overcrowded.
Yeah.
But it's not unique to us. And I guess that, in a way, is kind of a relief. But still, I feel.
What do you mean it's not
that
new to you? What do you mean?
I worked in the government system.
I know you work in the system.
In the healthcare system.
Right.
For over 30 years. And I've been up to the highest level around the table. And I think that was what really caused me to retire from public service, because the commitment, the ideas, you know, it's like everything is planned properly, but it doesn't seem to be able to trickle down
So what you think is
to
the root cause of this?
to the consumer.
Yeah. So what do you think is the root cause of this?
Root
How many of you
cause
are new today?
Huh?
What do you think could solve this problem? You said it does. You develop, but it's never hit.
It never seemed to get down to the ground level.
And what stopped it?
Because I think it have to do with the communication channels and how the plans are communicated to the people on the lower end. And is there, you see, communication is a two-way street. There's a sender and a receiver. But when the receiver gets the message and they respond, the communication now must go back up to the top. But if it never reaches the top, and you know, we have this hierarchy where everything comes down, but you have to get your head, your ears on the ground and listen to what the people are saying to you. Because if you're not listening, at the end of the day, you're not going to be effective, because the people know what side of the road the pipes are, what side of the road the columns are. So you have to listen to the people that are delivering the care, and you have to also work towards protecting them. You know, listen, the one thing that I feel so passionate about is the fact that these administrators have read and read, but do they apply what they read? Everybody could quote John Maxwell and management and what makes an effective business, but how many of them literally apply it? How many of them apply it to their everyday life, everyday work?
But they try, but it's a block in the step.
Yeah, you hear them talk about red tape, right?
Yeah.
Red tape. That's an excuse.
Red tape. That's excuse.
That's an excuse for inactivity.
So what's going on with Princess Margaret today is an excuse.
I'll just say this much, because I have been out of the system for longer than it takes for me to be an authority on what's happening at Princess Margaret Hospital. I do have friends and I do get inside information, but what I would say is that what is happening at Princess Margaret Hospital is when you try to constantly put a band-aid over a gaping wound.
Okay.
You cannot, I've heard about the government building a new hospital from 1999. That was before they implemented the Public Hospital Authority. Yeah, they built a new wing. But the population has multiplied immensely. Okay? The healthcare staff has increased, but the rate at which it's increasing is like as far as you can inject new staff, old staff leave. So you're basically just constantly on the middle ground. You're never really reaching the capacity for patient and healthcare ratio that will give you the level. But then you're working in an infrastructure that basically the population has outgrown.
Yeah, so that means I can tell the Bahamian people what I think, and you could piggyback off it. Straight up, people, don't go to Princess Margaret, yeah? Don't get sick. God help you.
I wouldn't endorse that.
No? Why not?
As it stands right now in the present COVID climate, I would say to the Bahamian public, invest in wellness. Stay stress-free, get adequate rest, drink a lot of water, eat healthy, and take your vitamins. Okay?
I don't get vitamins.
Don't get stressed out by all of what you are hearing in the media, in social media, as well as frontline media. Use your senses, use your intuition. You know, we all have inner wisdom. And if we would listen to our inner wisdom, we would be fine. But we don't. We go into the realm of every wind and doctrine, right? And we get caught up and distracted. We need to remain focused. We need to remain calm. Common sense. The flu is the flu. And just what you used to do for the flu, you could do for COVID. But in terms of remedy, listen. COVID was officially recognized as being in the Bahamas sometime between January and February of last year, 2020. When the year started, I was working and I was in a outreach with my employer. We did an outreach in Nassau, then we went to Freeport and we did an outreach there. I came down with a bad flu. Similar, I don't recall losing my taste and my smell because I was too busy doing whatever. I had a job to perform and I was performing it, but I was very sick. You know what I did?
What you did, man?
I am a naturalist in every sense of the word.
I know that.
Right? I eat natural, I sleep, I drink water, I do my exercise on a regular and all of that. But I came down with a cold. And the symptoms were similar in that we went to a franchise at Fish Fry. And while I was in that franchise, now I don't know if I pick up the bug in the hall that we had prepared before we went to have the meal, but while sitting there having the meal, my sore throat started. And by the time as I was home that evening, it was so terrible. But immediately, I implemented the things that I normally do. I drank water, because usually if you flush your system out by drinking a cup of water every 10 minutes, it usually helped to flush it out. But whatever it was, it didn't respond. So on my way to work the following day, actually that evening, I got some pain medication from my mom, and she had the very thing that I like to use, which is the Advil colon sinus severe, right? And I got that, but I was on that thing for the entire week. I actually had to buy a refill before I traveled to Grand Bahama. And by the time as I was ready to leave Grand Bahama, the weekend, which was like 5-6 days later, I had to ask my employer to get me some bisolvent to release all this mucus that was on my chest. The person who shared the room with me could testify. But the bottom line is that I recovered just on the bisolvent and my over-the-counter medication, but it was the worst cold that I had ever had. And I heard people talking about how badly they had that cold and so forth. So what I'm saying is that to me, that was January. February, I came down with the same thing again. Of course, I get up every morning, go outdoors and walk. And I couldn't figure out why it was that I was getting it. February, I came down, I overcame it. March, I came down, I overcame it. But April, I came down again with one that was so bad. And by then, COVID was just everywhere in the media. The bottom line is that at that time, the panacea was everywhere, but because of the sharing in the social media, I was able to home remedy with an onion poultice. Chop up the onion, put it on my chest. For 3 days, I wore that. And eventually, when it started to burn my chest, I realized, okay, I'm out of the wood. But I felt the flutter
What do you mean?
in my
What
lung.
do you mean burn your chest? Explain that to the people out there.
Yeah, it burns your skin
All
because onion is very, I don't know how many people realize it, but you put a piece of onion in the fridge and it permeates everything in your refrigerator. Even when you put it in a lidded container, the scent from that onion stays in that container for a long time. So what the onion apparently did was it drew out of my chest whatever consolidation I had in the chest, okay? But prior to using the onion, I was so afraid because I woke up one night and there was like butterflies flying in my lung, and I was like, oh my God, and I was afraid. I literally, because of my medical background, what I did was I laid on my bed and I allowed my head, my shoulder, and everything to face the ground as I coughed. And that was what really kind of helped whatever was in my chest to literally come out. But it was a frightening experience. So what I'm saying is I use Cerasee. I use, for me, thyme tea if it's sinuses. On that occasion, the sinus was not the problem, it was the chest. So the onion poultice was what saved me on that occasion. So 4 times. But do you know, from April of last year, I haven't gone to work. I refuse to go into public places because I cannot wear masks. I have a childhood history of asthma. So I stay at home. I have given up on income because I cannot wear the mask. I love my job. I love to work. I love to interact and help people. But if it's going to compromise my personal health, I'm not going to go out there. No amount of money. And yeah, did you get the vaccine? No, I didn't get the vaccine.
But if some people, you got money coming in, some people don't have money. So they have to go there. See, that's the difference.
Well,
you prepare yourself.
I am thankful. I am thankful for that. I'm thankful for that. But if I didn't have money, I wouldn't go out there. Let me tell you something. I'm going to tell you something that has played in the back of my psyche for some time. The way that COVID is going, and based on the economy of the Bahamas, which relies how much % on tourism?
All percent.
And the country has been closed now for how long?
Long time.
And so where does the government get money from to pay its employee, pay its pensioners and all of that? Borrow. So at the end of the day, what's happening with our country?
Putting in debt.
We're in debt. And if we're not able to pay the debt, what's going to happen to us?
Eventually, the bottom going to drop out.
Okay. So I am preparing myself. You see, what has happened in terms of this COVID situation is that we have become so dependent to the way that we live that we're not thinking of alternative ways of living.
No, we're not growing back.
We're not thinking about it. We just know that we're in our comfort zone and we don't wish to come out of it. But we have to develop the mindset that if we are going to survive in this life, we have to be able. God made us adaptable, you know. He made us adaptable beings. And so we have to be able and ready and willing to adapt and make small changes. Sometimes we have to make big changes, but we have to be prepared to make the change and be ready to sacrifice. Everybody was kicking and fussing and this and that and the next. Right now, people are dying by the thousands around the world.
They're dying in the Bahamas faster.
And they're dying here in the Bahamas now. Our numbers have increased tremendously.
Yeah.
And people are still wanting to live
we gotta live
the way that
we
have to live. But what do we need to live? What do we need to live?
We need to live,
but not at the standard that we're accustomed to. There are many things that we can shave off of our lives.
You ain't gonna take away my standard I used to live.
Okay, well then die then. Because guess what? The way that our country is built, ain't nobody can take it. It can slip right out of your hand.
But guess what?
Nobody gonna take it. It's gonna slip away.
But see, I don't want you to control me as a man. You're a woman. Nobody need to control you. So.
But guess what? Governments. That's kick.
Who? Yeah, but.
Thanks. That's Karen.
Yeah, don't nobody.
But she said.
Nobody controls me. Mm-hmm.
Karen says, boy, this some wholesome info today. Yeah. Enjoying this, very informative. Yeah. Thanks, Karen. Just trying to read the rest of your. Appreciate you.
Yeah, but like I say, right?
Mm-hmm. What I was starting to say, when you say you're a man and nobody could control you, I agree with you. But what is freedom? Freedom basically is when we are able to make independent choices that are consistent with the well-being of everyone. So if my life is affecting somebody else, I'm not really acting in freedom, I'm acting in selfishness. So governments are established to protect the interests of the people. And so sometimes the government have to take our rights away from us in order to protect the masses.
See, hold on, wait, see, now, hold on, see, now, just be careful here. See, I have my individual thinking, and I don't want you to take away that.
There's not your thinking, it's not your thoughts that's being taken away.
So at a point of time in my life, I think the government should guide me.
Yes.
But don't take away my rights. See, let me tell you why. My individually. See, if you can tell me. See. Wait. Let me get to the point. In the country now, you have gone and you shut us down, and you have tell us this and tell us that, but you still don't have no plan. Now you want to come back and tell me. Wait, hold on. I ain't gonna let you take it. Now you coming back and tell me we can shut you down again, which is fine, but I don't want you to control me. I want you to give me tools so I can understand. Tell me this is what we can do, and let me make that decision. Because if you continue shutting down the country, what's going to happen eventually? We can be sitting ducks here.
I agree, but Tony, tell me, based on what you see happening in the global arena, what's the alternative?
The alternative is this. This is my alternative. We should have, by now, substantive strategic plan that, okay, we're going to get some back to normalcy. We mightn't get there all at once, but we're going to get there. So what we're going to do, we're going to wear a mask, but we can try to live with this. See, because let me tell you why we should try to live with this. AIDS was around. Wait, hold on. AIDS is around.
With a different transmission
and we
process.
And we figure it out. And we live with it. We adjust and we figure it out. So everything in life is just take a little adjustment.
I appreciate what you're saying, and I agree with you that we will figure it out. And I think by shutting the country down, that was what they should have been doing or would have been doing, is working out the logistics on how are we going to address it. You see, AIDS is a behavioral kind of thing. You got to choose or be raped. But in airborne disease,
COVID is a behavior too.
Yeah, but it's airborne, and so therefore the behavior is you have to wear a mask, you have to keep your social distancing, and you have to wash your hands whenever you go in and out and doing things that are not in the confines of your home. Okay? Now, so many people have been affected by it. People that have been affected even on the job. I'm saddened by the amount of nurses that have been dying recently from this disease, right? But the government, there is no quick fix. And I understand what you're saying. No, see, from my personal experience as a healthcare professional, I agree with the measures that have been implemented. I cannot say that I disagree with it at all. Even though
I disagree.
Even though the economy has suffered as a result of it. But look at the countries where they have what we don't have and the amount of deaths. Right now, with the opening of the country, and especially with this false sense of security with vaccination. See, when the government first started, the government was operating not only by the standards that were set by the International Forum, they were working in operation with the mindset of the people. The government, when you don't know the mindset of your people, you are in trouble. So when I saw what they were doing, I could appreciate it because I was dealing and I was appreciating it from the global perspective, but also from the mindset of our people.
I differ. I totally
you can
because at this time, this I believe, even the situation without the Princess Margaret now,
right now,
the one we talking about, the people in the rain, and all that. In this day and time, I don't care what pandemic, what we have. Why is this happening? Let me tell you why is it happening. I believe, this is what I believe. I believe we're so slow of acting.
I agree with that.
We had a year or two with this, right? Year and a half, whatever. I believe by now we should then figure it out. I believe the makeshift hospital, finding a building, finding a place, and finding temporary changes. Could have been done.
I would love to pull out a trump card right now and say no, but seriously,
it could have happened.
Hold on, let me tell you something. I like what you say about the slowness to move, and I believe in leadership. And if your leaders are reluctant to move and take the calculated risks that they are recommended to take, then that's why we are in the state that we're in. So I'm going to tell you.
I'm surprised you say that.
The Public Hospital Authority had at its head a very decisive man that went out after the last general election. I don't need to call his name.
So.
Everybody know, because you could see the growth of the healthcare system under his administration. Albeit, but you see, our slave mentality and our jealousy is what caused us to be in the state we in as a nation, because we are still pulling one another down. We call it the black crab syndrome. We are always pulling one another down.
Well, we born in this race,
Yeah, but it's time for us to change that.
It would not change because we teach our children the same thing.
Exactly. We don't even have to teach it to them. You know why? They observe us do it to one another, and they come behind and do likewise.
But let me give you another black race. Another thing that I know. We, the black people, will stay working for the same person for 30 years and know we're not going anywhere. But because we are collecting a salary, it's all that matters to us. So what we say on the job?
That's where mediocrity is breed. That's where that kind of situation breeds mediocrity.
So all you care about, you getting a salary, and they're paying your bills. So you don't care about moving nothing forward.
You see, I want to really stay very clear
go back right here.
because I have inside historical experience of working in the system. Okay? But
not only the government, all systems.
Decision making, you have to be decisive. And I'm going back to John Maxwell and decision making and making your employers feel valued. Yes, if we had a system of accountability where if you're not performing and you are doing something, I get rid of you. I don't care if I need you.
Underperformers get promoted. See, in the police force, the fella who bring the news, you get promoted.
Yeah, but listen, I heard you did you hear that voice clip of the young lady where her mother called her and told her, well, yeah, because you mentioned about the rain and there are lots of video clips going around, but she said that her mother called her and asked her for tea because there wasn't anything. She was told now that there isn't anything for tea in the hospital. And, that's a very bad reflection, and people always jump on nurses. But I know for a fact that there are some nurses that really give the profession a bad name. But generally, I'm going to say 1 out of every 20 nurses might be guilty of that. Maybe.
No, sir. No.
I am telling you,
no, sir.
It ain't.
I love nurses.
1 out of every 20.
Hold on.
It ain't the masses. I'm gonna tell you.
Hold on. I love nurses. I give you a story about the hospital.
Yeah, but then that's still okay. In your experience, right? When you go to a particular ward, there are at least 5 nurses maximum, and that's the maximum you're gonna have on one shift.
I love nurses. Nurses
right?
Right hand.
And you're gonna tell me of those 5 people, 3 of them are no good and only 2 are good?
No, but see, the point I'm making is this: you're missing something here.
Go ahead.
You're missing on these.
I think we missed. Let me just see who else.
Oh, sorry. We missed. Oh, sorry. We had a lot of. We had a lot of nurses. The young nurses I'm talking about. They're the ones don't give 2 hooks. Come on now.
Not all of them. Not all
majority
of
them. The old ones will battle with you. And you know the story that I'm glad we hear. You know the story that I told you about. The information I got about how the nurse came on the bed and tell the lady, you better shut up. Because you wouldn't see tomorrow.
But you notice now, let me say
this. And she didn't see tomorrow.
And let me say this to you.
You know that.
But let me say this to you. The sad thing about healthcare in the Bahamas is everybody is given the label of nurse. But not everybody that is a female that work in a ward is actually a nurse. Right. Even if they're wearing white, they wear different colors and stuff like that.
But the nurses
get blamed for a lot of things that they have nothing to do with.
Let me give the nurses credit. I understand. I like nurses because without them, we can't really make it. Because the nurses do most majority of the work. The doctors only describe. The nurses is the one who give it to you. The nurses is the one who take you. The nurses do everything. So we must give a nurse a pop. I ain't going against the nurses. But there's some 1 or 2 bad apples in the park.
There are. Like you say, 1 or 2 bad apples in the park. And we're not going to dispute that because I had a conversation with a colleague just this week and was told of the nightmarish experience of a client. And then on the back of that was when I heard about this story with the thing. But let me say this. There are nurses who will take, if the hospital don't have certain supplies,
they'll bring it.
There are nurses who take things from their homes, sugar, tea bag,
all the
and
time.
the cream, and they take it into the hospital to make sure that the patients on their shift are able to get something.
I know stories where the old nurses will bring you tracts and Bible. They make sure you okay.
They meet your whole need.
Yeah.
Okay, Karen, thanks for your patience. As it relates to the time tea, the cooking time that you use to flavor your food, you boil the water. It could be the green leaves or the dry leaves.
Very good for asthma.
Good for asthma, good for sinus infections. Yeah. So you boil the water and you pour the boiled water on the leaves and you cover it and allow it to steep. After it is steeped, then you would sweeten it with honey. The honey has an antibiotic effect, and so does the thyme. Those two combined. But
it works
the
very
best
well.
thing to do is to allow it to get to room temperature before you add the honey, in order for the honey to have its natural antibiotic efficiency, effectiveness. Okay?
So I need to come back.
And so just half a cup a day, not more than that. Most people are familiar with, if you're pregnant, don't take it, because most people are familiar with using thyme tea to induce labor. So if you're pregnant, do not use the thyme tea for any infection, because it will cause you to miscarry. All right? So
you go to
Karen say we'll have to shut down if persons are being irresponsible. She tired of stubborn Bahamians thinking that it'll be threatening the well-being of others. Okay. We could have been past this long time. I agree with you, Mel. And then we are too passive as a nation. Sinus, yes, now to find the leaves. Just in the food store.
Right to the on Calpin Road, the Haitian have thyme.
Okay.
So you can get the fresh thyme.
And you can get it at the market as well, the farmer's market. But in the food store you can get it. Yes.
So, but I want Mel, this is actually just having this conversation with Karen. Is actually trying to let me know I need to bring back my natural show.
Yes. The tips for natural living.
We got I have a wealth of knowledge of natural living, so I need to bring back the tips.
Home remedies.
Home remedy care.
Yeah. So even though modern medicine will tell you don't mix it with your prescribed medicines, but I can assure you I have had that thing 4 times last year, January, and I have allergies, but I know it wasn't an allergy induced situation for me, because usually if it's an allergy it would be my sinuses, but those were literal chest infections, and I'm not someone to really get. But what I did was after April, after that dose, and I have not had another illness since then. I've stayed home. I do still exercise daily, but I would do my workout indoors. I only just recently started going out in the mornings again and exercising, but I've stayed away. I followed the rules, social distancing, and I've not been even going out
Karen,
to work.
Let me say this to you, Karen. I listened to you when you make the comment. COVID-19 ain't going anywhere.
No, it's not. And the vaccine is not going to send it away either.
Yeah, but it's not going anywhere. So shutting down is not going to stop it.
No, people just have to adopt a new normal.
And I think people are in the Bahamas war or still is. I think when we letting these foreigners in, this is where we're having these problems. And then there is some Bahamians who not disciplined, but majority Bahamians are following the protocol.
They have.
And
It
they
was
did.
a little slow.
Yeah,
It wasn't
but
as
when it-
as
but
rapid.
when they got
but
it there,
yes.
when they got there,
Yes.
yeah.
And
So-
people are still, because
and
I
people
watch
still.
people now.
So
and,
we
and
need
they are,
to find a way to work with this, and I believe the way to work with this is open up the country and adjust, because if you close it, there's some people can depend on that, and so when you open it back, you go back to the same thing. So I think you just open it and work with it. Now,
And if you apply the
Exactly.
the protocols, I
You wear
believe
your
the
mask,
safety
wash your hands.
will be as good as it was
You
when it
become
was
a part
closed.
of
But
it.
you have to apply the protocols.
And if you let it open, see, this is my point. If you open it and let us learn how to live with it,
yeah.
it become a part of us. It become our daily routine. Wash your hand, wear your mask. And once we did, we'd be fine. We were getting fine until we opened it up to the international people, and boom, there we go. Watching a piece yesterday on Facebook, where this lady who came to the Bahamas, and she was positive, and she started saying, I lick my tongue and all the doorknobs and all this, and she was saying that she not going to ambulance. This is the type of situation I'm talking about.
Yeah.
So when we let people in our country, and not just
But how
COVID,
do you
it's just not COVID. It's just not COVID.
No, it ain't.
It's generally,
yes.
you let
yes.
foreigners in your country, they will change your country.
But then that is what we live by, because tourism is our number one industry.
Yeah, but that's why we have to find. See,
we have to adopt the attitude of being able
safe
to
all the time.
what they call it's like responsible response to the irresponsible.
Right.
Responsible response to the irresponsible.
Right.
So we now have to safeguard ourselves, because the Bible said the poor would always be among us.
Always.
I say the idiots are going to always be among us.
tens
And
of
there
thousands.
are going to be haters all the time. People who come to the Bahamas as a tourist, but they have such negative, it's like they don't do the history to find out what they expect when they get here. The Bahamas is predominantly a black nation.
Now,
Yes,
what we black nation?
we are predominantly black.
You think so?
Yes.
Oh, wow. If we black, why everybody bleaching?
That, because you bleach, that don't make you white.
Man, they acting white.
That don't make
You
them
see
white
them with
though.
them here now. They walk white. They don't act black
And
no
listen to me, I'll tell you something. I smiled the other day because I was watching something, and this person was Hispanic, and normally Bahamians would call that person a white person,
Yeah.
but that person said, "We are people of color," and I'm like, tell that to a Bahamian. They call you white. But if you're not pure white, you're a person of color. Indian, whatever race you are, even Japanese and Chinese are not white. They
I'm
are
gonna
people
send the
of color.
Claren. I can send the Claren call out.
Mm-hmm.
If we don't stop this trend we have, that selling all our land
Mm-hmm.
to the rich and wealthy,
Mm-hmm.
and having all these Filipinos who white being up the black people no more, they can send all them back. All they can die out, because all this coming is squeeze together in the middle, and we can die out with the COVID, and we can die out.
Well,
If we don't stop.
clearly,
Because
that
even Bahamian women don't want no black children no more.
they never did. Now, come on now. You know, in our history, right? It's always the light-skinned grandchildren that get Grammys favor above the darker skinned grandchildren.
Even in jobs now, they cater more to most likely hire the white bright
The
person.
fair skin.
The fair skin.
Because you fit more into the profile of the white.
Yeah, but remember this. I am convinced they're black.
And you know, I could touch another thing, right? Because you know, you're a Bahamian man like white skin.
No.
Yeah, mango. Yeah, we call it mango skin, right?
No,
the lighter
one time
complexion.
One time ago, we wanted to take white home because mama and
For
mother.
the grandchildren,
Yeah,
right?
yeah.
Yeah.
Now black are the berry sweet of the juice.
Ha! Who sent out the clarion call on
I
that?
tell you why. And so we sent the clarion call, but guess what happened?
Uh-huh.
All the black girls trying to be white now.
No, I see them going with the white now.
Yeah, well, I want them to go with the white. Because
Anyhow.
the more the merrier.
And yeah, I'm so sorry we went off course again.
I'm not even on
today.
topic. That's fine.
But
What's
we as a people, we can do it. We can do it. We can survive COVID. And there was a message that I listened to extensively from a pharmacist called Miss Bullard. And she said something very powerful, because I'm not somebody who is political. But when I heard that, you know what I said? It's really time for people to stop this foolishness of making people. You listen attentively to what is being said about the vaccine. Why are you going to drive a wedge between the vaccinated and the unvaccinated population of this country? Why?
You know why?
Tell me.
Because we always dividing people. Our whole life are divided. Red, yellow.
Green.
No, it's just red and yellow. We dividing, right? Then you divide them, Saxon in the Valley. Mm-hmm. See, it's all vision.
Competition.
Catholic and Anglican.
Yeah. It's just repetitive.
It all.
Yeah.
And we dividing people. You black, I white.
Mm-hmm.
You poor, the rich.
Mm-hmm.
So we continue dividing our people in the Bahamas, and we are causing the biggest mess, because it is what it does. It make us, what that word I don't use. I wonder what these. It make us undermine. It's undermining everything.
I guess
that's why you can't develop nothing.
It seemed to be the spice of life.
Melanie, you see something?
We say the variety is the spice of life.
You are. You has a doctorate degree.
Mm-hmm.
Why are you sitting on the couch?
I choose to.
If I have a master's degree, why are you sitting on the couch?
Well, I choose to based on my experience.
Yeah, okay.
But
based on your experience.
When I was a master level trained individual in the healthcare system, I was insulted when I had the qualification, and there was a national survey conducted. In the office with me was also a master level person trained in health education and promotion. But the authority of the day brought in a consultant with an equivalent degree, not a higher degree, an equivalent degree, and they conducted this survey, and we were not even invited around the table.
Let's be honest, you didn't have the skill.
Stop talking foolishness.
Yeah, but that's in there.
No, we didn't have the skin.
man, let me break that down to you, man. I put that breakdown to you. That's what it was. You didn't look the part. You know it's getting there. See, you didn't have the crinkly hair. The long,
and then just how I look now.
Color. Yeah.
No earring, no makeup.
So this is what I'm talking about now, when they divide us. Because you don't walk the way they walk, and you don't dress the way they dress with their suit.
So the division.
Because the
division.
But
not only
they're
that,
near-minded, you know.
Not only that. Let me tell you what I hate, and I will continue to be a pauper or whatever it takes, as long as I have to bow down to another human being. It ain't gonna happen.
Well, you gotta bow down, because if you don't bow down, you never get the part.
I ain't gonna never get it then.
But this is what they do to Bahamian. Let me tell you what they do. They will get a white guy, a foreigner, and bring him in this country, and a contractor who here with the qualification, and they make him the white man in charge. But tell the contractor, you got to build the building.
Not only that,
and
they just tell you to train them, orientate them.
But he don't even know anything about it, but because he white skin and he walks a certain way and he says he's this, it's kind of weird that we do this to our own people, and our own do this. You know, You know, go back to my mother. Anyway, go back to my mother. My mother was a genius in her time, you know. She used to sit me down. She used to say, Andy boy, let me tell you something. If you follow them, you can end up in hell. And guess what? They want all us to end up in hell. Because if all us end up in hell, we equal. We have this. See, anytime, I go back to me. I'm just going to talk about me now. I went and achieved the highest level in the world in basketball programs and sports and all this. And my own people don't want me to, they don't want me around. And guess what? Let me show you how life is. I trained them. I took them with me. And now, because
Black crab syndrome?
yeah, but let me tell you, public out there. Let me get the people out there.
Or maybe it's the Willie Lynch effect.
Yeah, but let me get the people out there what happens to you. Because I know who listening, it happened to them. It is this. They don't want you to achieve because they can't achieve. And what they do in these systems and these programs and all the jobs, what they do, they undermine you because, and the lie they throw on you is that, oh, you believe he better than us. Of course, why not? My belief, I should believe I better than somebody, because I can stay in the crowd bend, you know, the black crowd syndrome. like if you won't stay in the dirt, and you won't be there all the rest of your life. My mother said, "Me elevate yourself."
Let me say this:
and they will keep you down in this country on these jobs. They will ride you.
Now you understand why our healthcare system is the way that it is.
Because
we blame the government for a lot of things, right? But it's the people employed by the government, you know.
But the government has a responsibility to make it happen. And the government is a part of it.
But let me tell you let me tell you another thing.
Tell me.
Let me tell you another thing.
The government system.
Somebody said a long time ago, I think it was like in 2000 and maybe 2007, 2000, maybe as late as 2009, I was doing a master guide certification, Pathfinders Master Guide. And the president of the conference at the time came that Sunday morning to address the campus. And his statement was that we have a lying culture in the Bahamas. And I was taken aback. But the more I moved towards the integration and the interaction with people, and I say that to say we blame the government, but oftentimes what is presented in reports are lies.
Majority of the time, somebody else.
And so the government, the decision makers are building on the lies presented in reports. Yeah. So we are blaming the government when it's the people employed by the government who are selling them, and they cannot go down on the ground and do these things themselves. That's why they employ people to take these positions.
I'm glad you said that. Let me. I work through the ministries. I work for my private work, and I work for ministry, and I seen this. Now I don't know why this happens, but I seen this in government program. Why you think the directors and the PS and everybody still have the key for everything? Everything locked up. They have to go to them to they have to go to them to sign signature. Listen.
Well, you know,
if you put
know, a lot of teething goes on.
No,
right?
But hold on, stop right there. If you put me, let's say 10 departments in here. Let's say 10 departments. Let's say the pink shop.
Accountability is a serious thing. We don't enforce accountability.
It's control.
And then why you think more people, listen, we go, or I am going to strike a chord right now, but we go to church every Saturday or Sunday, depending on what your religious persuasion is.
I mean, going there.
But we steal, we lie, we kill because we are not honest. And when I was growing up, you know what my grandmother used to say? A thief is a liar is a murderer. Because when you thief, you can lie to cover it up, and if it means killing somebody to keep that covered, that's what you're gonna do.
And you don't have to be physical killing. You could be killing them mentally, killing them,
destroying people.
Yeah,
yes.
yeah.
And so coming back now to the president back in the day, when I came home from school again, I heard people use the word black crab syndrome, and again I was offended because I am so big on Bahamian pride until somebody saw me the other day and it's like, girl, I was so mad with you when you gone to England and you come back and had your baby home. I don't know why you didn't had your baby in England. I was a Bahamian fool, and I still a fool for the Bahamas, because I believe if whatever is for my
country,
daughter,
folks.
whatever is for my children, if the Bahamas don't give it, you see, the Bahamas government changes, but God don't change, you know. And our directions are not determined by man. And we have to believe that first and foremost.
But I just...
And everybody wants something for free. There's no such thing as free lunch.
In the Bahamas,
and I have seen the way blacks are treated in the UK. I have seen it.
I am sick of the Bahamas when it comes to the way I'm treated in my own country. Listen, you want...
And that was the disappointment for me. I'm like, boy, I really should have stayed true.
Same thing with the hospital. Let's go back there. The way people are treated when they go there. Where people are treated in passport office. The way these things don't have to take as long as take. And you stand on this line and you go, and
but
then
Tony, things have changed even worse since COVID.
Yes,
since
but
COVID,
hold on. One person control everything.
But that's because that's don't
foolishness.
Exactly. So control.
See,
control. Everybody wants to control somebody.
Nobody can tell me that only one person signed this paper and they gone out for lunch. So I gotta wait till that one person come out.
Only in the Bahamas.
Yeah.
Only
and then you can tell me, oh, I send it to this apartment, and so they gotta do their signing off and then come to get a signature. It takes. Let me tell you what's going on. And I real talk now. You get me hot now. Real talk. There's too many basketball talk, too much sweethearting talk, too much your own personal stuff when you come to work. Let me tell you what Bahamian does.
Soap opera talk.
Yeah. You come
Netflix,
to work.
Netflix, Greenleaf, everything.
You come to work at 8 o'clock. You want to leave 4. But you only want to do 3 hours work. And then you don't want to do the work. And then when you get an attitude, somebody make you mad. You ain't doing it. You holding up everybody. Oh, well, I'm mad now. I ain't signing nothing. I done signed 5. Let me tell you something.
It's really bad.
Bad. If I go to you, listen to me. If you say to me, you work 8 to 4. Don't tell me I come 5 minutes or 2 minutes to 4, I can't get saved. Because you say 4 o'clock. See, this is a bunch of foolishness. Let me tell you all.
Do what the banks do. Lock the door and don't let me in. But if I in, you can't turn me away from the counter.
So we got to.
Or you shouldn't.
And you know what the problem is? Let me tell you where the problem is. Ain't the people who working, you know. The problem is the Bahamian people takes it.
Yes. But they become frustrated because guess what?
We takes it. What we need to do now, let me tell you what we need to do. We need to put it in black and white all the time. That's what we need to do. Bahamian don't like right.
But you know,
we need to do that and put pressure to bear. If all of us start writing, and these people know this going on their file to be seen, and when come promotion time and this time, that on the file. See, we need to.
So the systems have to be set up to make their employees accountable.
Right.
You are there to serve, you know,
and serve the people.
Servant.
So listen, you go to national insurance.
And if you're providing excellence and care, people
folks, if you don't believe me,
you.
Folks, if you don't believe me, you try to go to national insurance 3:45 to pay your money. You know what they can tell you? You can't do it because
cashier and close.
Yeah, the cashier and all the cashiers together close and all kind of nonsense. See, because they need 15 minutes to tally. You tally after. Listen, you tally after 4. The public time is 4 o'clock. Then you go,
Set up the system in a way that.
and then you go to these
Yeah.
places. Everybody in the Bahamas looking for tips, looking for
do
favor,
their job.
looking for the. Listen to me. I don't need to tip you to do your job. You're getting paid to do your job. See, let me tell you what need to happen in the Bahamas. Oh shucks, this real. You know what need to happen in the Bahamas? The government need to have a way where the government checks into your bank account. Let me tell you what it is. You see this thing?
Now
right there?
you just talk. We start this show that they talking about your privacy and your right and your freedom and all that kind of stuff. So how the government could go
the
and check
public
people
bureau coming. They say coming, right? This new bureau thing where they can check on you.
with the sand dollar?
No, the bureau where they can check.
Oh, okay.
When you go on loan and they can check you owe this one, owe that one, you can't get. Okay.
Oh,
okay.
that one.
Let me tell you what the government needs to do. Not even the government. Let me tell you what needs to happen in this country. We need to now, all these people on these top jobs, government jobs, we need to investigate them. So when you get $100,000 in your bank account saved, and you're only making so much money, where you get the money from?
Oh, that.
See, it's time that people be accountable, and it's time that we deal with, because these people believe that when you step in the office, that can't be done, but I can sort it out for you. See, let me tell you, this fool, and so you take my paper and leave it there, and you doing everybody else's paper because you want me.
Because they give you.
Because you want me, yeah. See, this tipping foolishness. What we need to do on this job is stop the tips. Tell them no
but
more
those
tips.
aren't allowed. Those aren't allowed. That's habits that people adopted, and because nobody has reported it.
Because
only
too
the
many
police
people,
is penalized when people tip them.
Right.
Everybody else, they don't want to do their job unless you giving them something.
Yeah,
but you have a salary, and your salary is coming from the public purse.
Bahamians is so.
She say facts.
Yeah, Bahamians is so got in this culture of begging. Now everybody walking and begging.
Greedy, man. It's greed. That's
COVID make everybody beg. Everybody beg. Everybody. You all see something? Go stop to buy lunch somewhere or buy somebody you're begging. Or everywhere you go now, somebody begging.
Mm-hmm.
And so the point I'm making.
But that's greed.
We
And
gotta stop
I
this.
saw the greed. I saw the greed manifested, Tony, when COVID started, and people that were employed didn't get cut, and the food packages were being given out, and people who didn't need to go were going and collecting.
Our
this
country
food.
is so
It's
so disgraceful
yeah.
now.
We
We turn into bandits.
We lost.
Like I tell them, the
we
children
lost our
is
care.
pigeons. The parents become bandits. Let me tell you. Take that time and fall in love. Take that time and spend with your family. Stop trying to look for this money. Anyway, you're trying to get all this money. Listen, you ain't carrying nothing to your grave. So you might as well enjoy yourself on a love your significant other. Get involved. I mean, help when you can. But please, man, stop this greed and begging and this one. You'll see something? Why you think the Haitians and the Jamaicans getting all the job? You ask a guy to come to put one piece of wood up. He see light bill. He say, oh, I can pay my light bill. He say, $400. He even check the price. He just say $400. Out of him, $400. You know why? He light bill. Then you call the plumber. $300. He doesn't see his sweetheart money for the week. See, they don't. And this culture.
But then not only do
this
they
culture,
charge a large amount of money, how many of them are creating bad reputation for Bahamians because they don't deliver?
Exactly.
They don't
That's
deliver
why the foreigner don't,
quality product.
The foreigner don't hire them no more. The people who got money don't hire them. Don't hire Bahamians.
All the jobs
go
filled by
foreigners.
expats.
You go the air conditions, Mexicans. The gardening and the mason work, Haitians. Carpentry, Jamaicans. So
masonry
Bahamian
and
man,
construction too.
they won't come on your job, and the first thing they will do in the morning is smoke their dope, all right, and talk, and then work at 10 o'clock. So, and then they come work because they want you to make the money. They say, boy, you making all the money, no boy. Let me try to. Bad man. We are in trouble.
And we're losing round and round.
We gotta get it up.
Round and
Boy, I
round.
have a
That
question.
false sense.
Jesus, I have a
that
question.
false sense of importance.
Somebody asked me a
and
question.
rights.
Somebody asked me something they want me to. I better. My time short. Oh, my time gone. Eh?
Actually, yeah, but you
So,
better answer that question.
What was that
before-
question again?
I don't know. I don't know.
Let me tell you. And I'm in close with this. Sweetheart, this is the question. Why Bahamian man over 65 believe they could handle these young girls?
We better take that up in the next show because that's a whole show.
Yeah, that could be a whole show.
So next week, for sure.
But I can answer. All right, listen. I gonna answer, Miss Roll. I can answer that for you. But I couldn't get it. We get carried away. Melanie get on that track, man. Melanie gone, and so we get carried away. So I'm gonna take that up, and we gotta remember that I can't.
Yeah, why men over
65
think that they should be dating younger women?
Yeah, because a lot of married women having issues with their 65-year-old husbands going to younger gal. I don't blame the dudes. It's sweet.
But we'll talk about that next week.
So,
but this was an open forum, as you can see, because of the issues that are so prevalent in our country this past week, especially with the COVID and the healthcare system. So as we wrap up, we just want to plead with our fellow citizens and people around the world. Invest in your well-being. Stay away from the things that are going to play on your mind, all the information, and just adhere to the policy. Now, there's a lot of discussion about the pros and cons of vaccinations.
Don't worry about that.
You follow your inner wisdom. Listen to what might be out there, but wisdom comes from on high. And if you don't know what to do, pray about it and ask God to show you.
Well, let me tell you
what choice you should make. Don't listen to the noise in the market.
I can tell you what to listen to.
As the pharmacist said, everybody responds differently to different agents. For me, if somebody come in my environment with a cigarette and smoking it, I get sick. Others may think, oh, she's stupid. No, that's how my body reacts. I have a history of asthma from childhood, and there are certain things that I just have to stay away from. And COVID has taught me you can't wear the mask, because even in my practice as a nurse, when I worked in the theater, I would go in, and it's an air-conditioned operating room, but I would go in, I would do what I have to do, but I have to come out after an hour maximum and take off my mask, get some fresh air, put my mask back on, and go back inside the environment. Yeah. So I'm not one to wear masks. So COVID has said to me, stay home. I am thankful for the blessings that God has given me through the years that I can stay home. But if I couldn't stay home with my nursing capabilities, I guess I would have to babysit, keep somebody baby for $10 to help me be able to buy some food. And Tony, if you know me half as good, electricity and all these other things, I know how to go outside and scratch rock and make flint fire. I'm not prepared, I'm not afraid to live a simple life. The comforts, the heat, the summer, the air condition does me wonders. But if I didn't have air condition, I would find me a cool tree to sit under.
Well, we're here under the tree. We're supposed to be sitting in the couch today, but we're supposed to be under the tree. So we can soon go back to the under the tree. We just
when the heat waves are
she
gone.
complaining about the heat.
I can't do it.
It's just only heat. I don't see why. No big deal. We go under the tree.
Heat and I think I'm comfortable in saying every woman knows that after you get a certain age, your thermostat just don't function like it used to.
Well, we gotta
So
take that thermostat
you have
out.
private summers, so private summer on top of the natural summer. Hey,
So she's
I
saying.
staying cool.
So she's saying just as the sun goes back down, calm down.
Yes.
We go back out under the tree.
Either that
Fair
or we
enough.
could do a very early morning show in the cool of the day before the heat of the day.
What we
But-
can do. What we can do.
Mm-hmm.
We just watch and see how it goes. But we must close because the time is going.
Yes.
And we want to send a shout out to all our friends out there, Facebook, Twitter, YouTube. Want to say hello to everybody and make sure everybody have a good week, because in this life today, only you will take care of you. And COVID-19 ain't going nowhere anytime soon. So you take care. You do the things you
Yes.
need to do to take care
Follow
of
the
you.
protocols.
Do what you got to.
Eat healthy, rest well,
Right.
stay stress free, get some sunlight, drink a lot of water,
Get your job.
and
Get your job if you have to. Wash your hands. Wear your mask. Keep your distance. And the show is yours.
until next week, when we will discuss why men over 65 like to go with younger girls.
I swear.
Enjoy
to
your week.
me,
Stay safe.
and
This is
which
serious
I am
times.
certain
Practice the protocols.
I give
Keep yourself
my
and your
life
family safe. It's
and
sad to
every
see
step
whole families are
on
being
the
lost to this
way.
quote unquote disease.
More
It is such a dis-ease that we really do have to take serious precautions and protect ourselves. But above all, let's invest in our personal well-being. Focus on wellness and not on illness, and you'll be doing just okay. So while Tony's do his way, we're gonna say goodbye until next time.
Next time, same place, right here, under the tree. Next week, we'll meet. 3 o'clock. What love got to do with it? Have a great day. Enjoy your day. And do it your way. Have a great day.
Under the tree.
Under the tree.